Now, the next speaker is we are going to be back to Alex, and Alex is going to talk with us about the Global Alcohol Action Plan. Alex, please.
Okay, hi, thank you very much, Hamed. When Hamed was preparing this today's meeting, I thought it would be a shame not to mention this. It's a great opportunity, and it is very, very relevant to what we do, what we try to do. And so I'm going to give you a framework on behalf of the WHO. Originally, we asked Vladimir from the Geneva HQ to present, but he gave us the permission to use these slides. So again, I'm assuming that most of you know about the Global Alcohol Action Plan 2022-2030. If you don't, it's okay, but hopefully by the end of my presentation, everyone would know about GAP. So I think in a way it's a no-brainer for most of us, if not all of us, to realize that there is a health burden following the harmful use of alcohol, and which results not only in a multitude of morbidities, but actually the latest figure is that there are 3 million deaths globally that are directly attributed to alcohol. And the disease burden is, of course, surprise, surprise, highest in low-income and lower middle-income countries. So, in a way, there is no really more better reason to argue that actually it's not only globally important to look at, the morbidity, mortalities as a result of illicit drugs or smoking, nicotine, legal drugs, but also another legal drug, alcohol. So there's been a call for action in the last 10 years or so, and again, I'm not going to repeat, but the titles include the global strategy, the SDG health target of 3.5, the NCD action plan, as well global monitoring framework identified that something needs to be done. So despite again the need to do something different, there's been positive trends, but not enough. That led to a decision by WHO Executive Board to accelerate the action to reduce the harmful use of alcohol. And the decision has been taken that in the next 10 years or so, we need to develop an action plan. And a couple of technical reports as well. But I think the important thing is, and the reason why I'm presenting this is because this is more than just a talking shop, or about saying that we would like to do things. There is a very clear mandate for us as clinicians, for us as members of local, countrywide affiliated society, and especially for us as International Society of Addiction Medicine. And that leads us to the next slide. So the goals and structure of the Global Alcohol Action Plan includes 6 key areas for global action: implementation of high impact strategies, advocacy, awareness, commitment, partnership, dialogue, coordination, technical support and capacity building, knowledge production and information systems, and resource mobilization. Now, even with the presentation that we just heard, the excellent presentation of ISAM Jan, you could see that we are very well placed to support this alcohol action plan through knowledge production, new knowledge production. I call it intelligent knowledge production and information system. This is one very good example how we can work in order to support this action plan. But if you look at these 6 operation objectives, I highlighted the ones which I thought would as well be part of our mandate, not just as International Society of Addiction Medicine, but even as clinicians. First is strengthening multi-sectorial action through effective governance and political commitment and leadership. Most relevant and important when it comes to patients, enhancing prevention and treatment capacity of health and social care systems for disorders due to alcohol use. And as I said, the strength information systems. I think what's also important is that WHO has also taken a position that the alcohol industry is a very powerful lobby, and there needs to be not necessarily an equivalence in the strength of information gathering, but the relevance of creating evidence-based policies rather than policy-based evidence. So within each of these 6 areas, there is responsibilities of member states, governments, WHO secretaries, and then third, and again, I cannot reiterate how important our organizations are when creating these proposed actions for international partners. And I was honored to be in Geneva a couple of months ago, where we had ISAM members and other members of other organizations, where we have agreed to work together on this. And only recently I have sent a formal letter on behalf of the ISAM community to reiterate that ISAM is happy to support at any level using any of our products and any of our expertise. I think that is it. Yeah, and if you want more information about this, you'll find it on the website, either through the Sustainable Development Goals or through the Global Alcohol. Thank you.
Thank you very much, Alex. Thank you very much